Elderly patients who suffer from dementia and are in a hospital, nursing home, and sometimes even in their own home tend to be depressed, scared, anxious, or agitated. Presently, the way we deal with the patients who are anxious and agitated is A. to have a 1-to-1 nurse-patient ratio, not always possible, B. physically restrain them, C. chemically restrain them, or D. a combination of the above. Restraints, however, are not ideal. Not one person I have met likes to see their loved one in a restraint. In fact, some people's loved ones flat out refuse it, despite the risk that patients will hurt himself or someone else. But what can we do? How can we not use restraints when a patient won't stay in bed and you can't have a 1-to-1 ratio? Well, there's evidence that we can actually decrease their agitation or anxiety with something called music therapy. But what is music therapy?
Music therapy isn't a new idea. It was actually developed in the late 18th century. The definition of music therapy is the application of music to the treatment of a physiological or psychosocial aspect of an illness or disability. In other words, when music is played, it can alter the physiological or emotional aspects of a patient. Think about it with yourself. If you listen to angry music, you get angry. If you listen to sad music, you get sad. If an anxious or agitated patient listens to their favorite music, it tends to relax them. All you have to do is play their favorite music for them for 30 minutes a day, and their agitation or anxiety will tend to decrease.
So what this means is that playing our patients' favorite music for them for at least 30 minutes a day has the potential to decrease or eliminate in some cases the need for restraints or a 1-to-1 nurse-patient ratio. Let's observe how an agitated patient might behave. You can't get out of the chair. You need to stay in the chair.
Up, up.
Stay in the chair, Mr. Smith. Put your leg back in. As you can see, the patient is becoming more agitated, and intervention is needed. What do? Let's see what happens after the patient's favorite music has been played for several minutes. Okay, I'll see you later, Mr. Smith. Sometimes the results of the decrease in agitation or anxiety won't be as obvious as the ones shown on the video. So how do you measure the effectiveness of the treatment? Well, there are a couple of tools you can use, one for agitation and one for anxiety. There may be others, but these are the ones that were used in the studies I explored. The one for agitation is called the Cohen-Mansfield Agitation Inventory. Let me show you what this inventory consists of. As you can see, there is a list of 29 behaviors that are being monitored in this scale. At the bottom, you'll see the list of frequencies matched up with a number. These numbers are added up for 29 behaviors to give a grand total, which can be compared to future and past behaviors that have been scored. Now let's talk about the RAID tool. The Rating Anxiety in Dementia is a brief screening measure comprising 18 items rated on a 3-point scale. A total score of 11 or over indicates significant anxiety symptoms. The symptoms of anxiety can be monitored by using this scale if desired. Patients who suffer from dementia frequently become anxious or agitated, which not uncommonly ends in the patient being restrained, either physically or chemically. On rare occasions, there is the opportunity for a 1-to-1 nurse-to-patient ratio. There is a treatment that has been proven to be effective in decreasing a patient's agitation or anxiety, which is called music therapy. This treatment leads to the potential of multiple gains. The patient might leave the tubes and lines alone. There is a smaller chance the patient will fall. It keeps the nurses safer, and it could save nursing staff's time by making it possible for the staff to leave the bedside and perform other tasks. Sound interesting? 30 minutes a day. Give it a try.